All right, it's time for me to learn a little bit on this Friday. Living in Colorado, keep in mind that high altitude equals a high risk for skin cancer. This morning, Dr. Renata Prado from Vanguard Skin Specialists is here with some advice, and she's going to apply some SPF 50 on my nose because we all know I can certainly use it. Good morning, doctor.
Good morning. Thanks for having me.
I've been in Colorado Springs now for 8 months, and I still need to get in my head that we are a mile closer to the sun, and that pays immediate dividends. Is that correct?
That's absolutely correct. So in Colorado, we do have a higher incidence of ultraviolet radiation. The intensity of the rays are greater here because we're higher elevation. Every 1,000 feet up in elevation, you get about 6% greater intensity of the ultraviolet radiation. So let's say you go to Vail, 10,000 feet, you're talking about 60% more. So really a big difference from sea level.
Plus in southern Colorado, it's always sunny. I mean, even in January, it could be sunny, so you could be catching some rays. You're a skin cancer specialist.
Yes.
You know, cancer is one of those words. It just has no good connotations. How prevalent is skin cancer?
So skin cancer is incredibly prevalent. We have, the numbers are incredible. We have 5 million new cases of skin cancer every year. We estimate 1 in every 5 people who have skin cancer and at some point in their life. And this is the most common type of human cancer you can get. So skin cancer is more common than any other cancer, and in fact, it's more common than all cancers combined. So incredibly prevalent.
Well, what are some signs that somebody should go to a specialist and get checked out?
So if you have anything that's new, growing, changing, so there are many types of skin cancers, they present differently, but anything that's changing size, shape, or color, anything that's bleeding, scabbing, and not healing, these are signs that you should have a dermatologist check it.
What is the treatment process like? Is it curable?
So skin cancer is treatable and curable when caught early. So you want to make sure you have the diagnosis as early as possible so the treatment is as easiest and with the best cure rate possible. There are a variety of different treatment types, all the way from topical creams to surgery. So the sooner you have your diagnosis, the better your treatment will be and the higher cure rate it is.
You and your team use something called the UV index as a good gauge. What is the UV index all about?
So the UV index is something that we see being usually presented together with the weather forecast, and it tells you, gives you an idea of how intense the ultraviolet radiation is at that time of day in that location that you're in. So think of it as, for instance, if you are planning on a hike or a walk and it says it's going to rain, you're going to prepare yourself. Maybe either you're not going to go or you're going to go with an umbrella or a raincoat. The UV index tells you how intense the radiation is on a sunny day or even on a cloudy day. So if you're planning on going outside, you can prepare yourself. A higher UV index means greater chance of skin damage.
Vanguard Skin Specialists, you guys are really incredible. Dr. Chung's a good friend of the show as well. You're amazing. What kind of services does Vanguard offer?
So Vanguard offers all treatments of skin conditions, but our top priority is skin cancer because skin cancer is curable and treatable when it's caught early. So we want to make sure that patients are seen as soon as possible. In fact, we have something called the
WOW program. Wow, yeah. Tell me about it.
So the WOW promise is something we have to our patients. It means within 1 week. That means that if a patient has one of those spots that they're worried about skin cancer, something that's growing, changing, and they're worried about skin cancer, they will get to be seen within 1 week in one of our offices by one of our providers. We'll fit them in the middle of the day, we'll fit them in at the end of the day, we'll see them on Saturdays if that's what it takes, but we'll get the patient in as soon as possible. In that visit, we'll be able to examine the spots, see if a biopsy is necessary. We do have an in-house lab. That means that we get the results fairly quickly, and this way we can offer the treatment in a very timely manner.
The WOW promise. You're making me say wow a lot. It really is incredible. Favorite sunscreen to use real quick? Favorite sunscreen you like?
Oh, I
need to go buy some.
I'm biased. I like the Vanguard. We have a Vanguard
you have your
brand.
own? Okay.
Yeah, it's fabulous.
Oh, you have a gift shop. They have a gift shop at this place. I love this place even more. You know, I haven't had to deal with skin cancer, but I I had acne growing up, and that was disgusting. So I wish I had a doctor like you to take care of me when I was a teenager. But you are the best. Tell Dr. Chung we say hello as well.
Absolutely. Thank you.
You can go see them within a week. It's the Wow Promise. Vanguard offers dermatology service, aesthetics, skincare, you name it, they've got it. Visit the website on your screen for a full list of services. And Dr. Prado, she really is the best. We'd also like to thank Vanguard Skin Specialists for bringing us this segment.